Happy Thursday. It's time for my Thursday thoughts. So my thoughts today are about being proactive with fall prevention versus being reactive. I think healthcare in general right now is reactive when it comes to falls with our elderly population. I see it with just the referrals we get. Probably 90% of my referrals is because of falls already happen. And these people were a fall risk. They used adaptive equipment. They were fearful of falling. They stopped taking showers because they were fearful of falling. All those things were in place before the fall happened, yet we didn't do anything about it. Majority of the falls in the home, almost all of them are environmental. And I walk out of many homes thinking, gosh, if I could have gotten in here before the fall happened and made those recommendations, that fall may have never happened. And they were a fall risk before the fall happened. They used a walker, which if you look at the study, that's 2 points. And they had a fall in the last year. That's 2 points. That's 4 points. That means they're a fall risk. So it's important that we address that now. Our population is growing here in the state of Florida. The 65 and over population is expected to grow a third over the next 5 years. Medicare spent $30 billion last year on fall-related injury healthcare costs. And that doesn't include your managed care, your Medicaid, people that don't have insurance, the financial burden on families when the fall happens. You know, if mom lives in Florida and you live in Virginia and mom has a fall and breaks a hip and is in the hospital, and all of a sudden now you got to miss a couple weeks of work because you're coming down to make sure she's taken care of, make sure she gets set up, figure out if it's safe for her to go back home, if she needs to go to a rehab center. So that's time you've missed from work. And also the loss of independence and functional, being able to be functional in your own home. If you're 85 years old and you break a hip and you might not be a candidate for a surgical procedure, then you're not going to walk again. And all of a sudden you may never get to go home. And this could be someone who was going out to lunch every Thursday with their girlfriends and was playing bridge on Tuesday afternoons and went to church every day Sunday. And all of a sudden, all that is gone. So we really need to look at how to prevent that fall before it happens. Are we going to prevent every fall before it happens? No, but we've got to give it a fighting chance. If we could reduce falls just 25%, that's billions of dollars. That's reduced burden on our stretched healthcare workers that are already stretched thin. Our emergency rooms, every 11 seconds, someone is being seen in an emergency room due to a fall. And those fall numbers, I honestly don't think they're 100% accurate. Matter of fact, I know they're not 100% accurate, and I'll tell you why. I can't tell you how many times I read a chart and they'll say no falls reported. Get into the home and the husband within 5 minutes being in the home sells out the wife and tells me, oh no, she fell last week and she fell last month. Or I get in the home and a patient realizes that I'm there to help keep them there and to keep them safe. And then they get honest with me and they tell me. The amount of people that stop taking showers and baths because of either they've had a fall or they're so fearful of falling, that needs to be addressed. All of those things need to be addressed. We do so many things right in our country when it comes to healthcare, preventative, mammograms, colon cancer screening. But we're missing the mark when it comes to fall prevention. We're not being proactive. We're not looking at going a different route because what we're doing right now is not working. It's not reducing falls. Falls keep going up and up and up and up. People are living longer and people want to live at home. And that's where the majority of the falls happen. So folks,